Hello, I'm Dr. John Preston with Alliant International University in San Francisco, the clinical psychology program. And on the short video, I'd like to talk with you a little bit about the role of melatonin in treating sleep disorders. Melatonin is a naturally occurring hormone that is secreted by the pineal gland, and during the day, the production of melatonin and secretion of melatonin is suppressed by the exposure to light. There's a pathway that goes from the retina to the hypothalamus that called the retinal hypothalamic nerve that transmits light energy to the hypothalamus and then to the pineal gland. And as long as there's light, then it suppresses the release of melatonin. But when darkness occurs, then melatonin begins to be released. Its role in sleep has not been well understood. It's not, in a sense, what causes sleep to occur, but it appears that melatonin plays a role in creating the kind of conditions that allowing people and other mammals as well to go into sleep, and especially into slow wave or deep sleep. What's interesting is that in birds and reptiles, they also have a pineal gland, but it's located up high enough in the brain, and they have very thin skulls that light actually penetrates through the skull and directly affects the pineal gland and regulates sleep cycles that way. However, in mammals, because of thicker skulls and also because of the fact that the pineal is deep in the brain, then it needs to be stimulated by activation of the retinal hypothalamic nerve. Now, what's new about this is there's new guidelines coming out in the Journal of Psychopharmacology for sleep disturbances, in particular talking about guidelines for use with children. Research on the use of melatonin in children has been very scant. It goes back to 1995. There have been a few studies, generally using very small sample sizes, and until just recently I think the jury has been out on this in terms of efficacy and safety. But in the new guidelines published in this journal, it does recommend the use of melatonin in children as well as adults who are having sleep disturbances. What's unclear is the exact dosing that is required to achieve satisfactory results. A lot of the studies have used rather high doses, like 2 milligrams or 3 milligrams at night, and those kind of doses do promote drowsiness and sleep. Some researchers have recommended that an alternative use is to dose half a milligram about 4 hours before going to bed. In this case, melatonin, smaller amounts of melatonin do not produce drowsiness, but they, in a sense, prime the pump. And what appears to really happen with melatonin is it helps you facilitate movement towards a greater quiescence, which of course is going to be important for sleep, but very importantly, lowering body temperature. And it's important to cool down the body in order to be able to go into and experience adequate amounts of slow wave sleep. So I think that despite the fact that guidelines have come out now, this still should be considered to be experimental treatment, especially in the use of children. But the guidelines do provide some promising support for the use of this relatively benign molecule in the treatment of sleep disturbances. Thank you.